Hello everyone. I am Dr. Atul Sharma. I am a medical oncologist, a cancer specialist working in Jaypee Hospital, Noida. Today we are going to talk about something about cancer. Cancer is a group of diseases with similar characteristics. Cancer is a major public health problem which our country is facing and is going to face in the near future also. The incidence of cancer is increasing. There is a national cancer registry program, though there are parts of our country which are underrepresented in this. However, even if we go largely about this cancer registry, there will be 3% increase in cancer patients per year, which will amount to almost 8 lakh cancer patients per year. So the magnitude of this disease, the burden of this disease is huge. So that is why it is important to know about this, to understand how we can detect it early and how we can treat or manage it. There are many risk factors for the cancer. First and foremost, the tobacco. Tobacco chewing, the chewing of tobacco, which is even more prevalent than smoking. In our country, it almost accounts to 50% of the cancers in the men and around 17 to 20% in the women. Further 10 to 20% of the cancer they are attributable to the lifestyle disorders or the lifestyle habits. Increase fat intake, increase intake of red meat, rapid urbanization and westernization. These all changes have led to the increase in the incidence of cancer in our country. Now, coming to the risk factors, for example, if we talk about the cancer of the head and neck, tobacco chewing is the single most major factor. Then the upper aerodigestive tract, that is the food pipe and stomach, taking a lot of red chilies, taking food at higher temperature, obesity, alcohol consumption. These are the risk factor for the food pipe and stomach cancer. If we consider or talk about breast cancer in women, early age of menarche, late age of menopause, and late age at first childbirth, single child, these are certain risk factors for the breast cancer in women. Regarding cervical cancer, this is again among the common cancer in women in our country. However, with the improvement of the hygiene and improvement in the living standard, the incidence of cervical cancer is decreasing in the urban areas, but it is still a problem in the rural areas or the villages. With the kind of cervical screening that we have, and with the advent of the vaccine also, the initial results are very promising, and the improvement in the sexual and the hygiene, the incidence of cervical cancer is reducing. However, with the sexual behavior of the young adults, we may see a second wave of cervical cancer also. Taking high quantities of red meat can lead to the risk of colon cancer. There is a 5 to 10% risk or the genetic factors which also play a role. There is certain amount of the environmental exposure, such as the environmental pollution or the lifestyle, which also affects our genetic predisposition. Our one of our major problem is that we diagnose cancer at later stages, we fail to diagnose them at earlier stages. So what can we do about this? We need to make ourselves aware about this. We need to include this in the curriculum in the younger age. We need to target people. We need to make people understand at the younger age. So this should be in the school curriculum about the awareness of the cancer. Then we should avoid habits such as I have enumerated so many times, that tobacco, alcohol, lifestyle. Then certain cancers we can detect them early with the help of screening, such as breast cancer. We can do self-examination and we can do mammogram once in a year. Cervical cancer, we can do Pap smear, we can do HPV DNA testing, which help us to understand and pick them in early stages. Then we have vaccination. We have vaccination for hepatitis B, which can prevent the liver cancer. We have HPV vaccination for cervical cancer. Colonoscopy can help us detect the colon cancer at early stage. We have low dose CT scan for those who are at high risk of lung cancer, such as chronic smokers. So these are certain things where we can detect things early. If we have any symptom such as prolonged cough, blood or bleeding from any site in the body, a lump which is progressive, which is increasing in size, significant weight loss, unintentional significant weight loss, any chronic symptom which has become chronic and is not getting relieved, we should take help of a doctor. We should try to evaluate these symptoms so that we understand that we may not be suffering from a deadly disease such as cancer. Now, coming to the symptoms for the organ specific cancers in detail, such as cancer which are more prevalent in women, such as breast cancer, any painless progressive swelling which is increasing in size. This can be a harbinger of breast cancer. Frequently patients, they do not seek help because they say it was a painless lump, it was not causing any symptoms. So I usually tell, the more the painless or a symptomless, more the chances that it may be a cancer. Then any discharge from the nipple, particularly the bloody discharge, any asymmetry, any change in the texture, rarely it can cause pain as well in the breast. So this one should get alarmed with these symptoms and should seek help. Regarding the cervical cancer, any bleeding which is unusual from the normal, bleeding in between the periods, post-coital bleeding after a sexual intercourse, or any bleeding in a post-menopausal women, this should be taken seriously. And there used to be a dictum that any post-menopausal bleeding should be taken as endometrial cancer unless proved otherwise. So these symptoms should be taken seriously and evaluated, and you should consult your doctor for these evaluation. Now coming to the stages and treatment of the cancer, if we say grossly or roughly we divide each cancer into four stages: stage 1, 2, 3, 4. Usually stage 1 is when the cancer is smaller in size and is confined to the organ only. In stage 2, usually cancer achieves a bigger size, and at times it involves the regional or the lymph nodes which are in the vicinity. And in the stage 3, mostly it is a large size tumor with the significant number of lymph nodes or the lumps in the vicinity. And stage 4 is where cancer from a particular organ spreads to the other organs. So this is called as stage 4 or a metastatic cancer also. If we talk about the treatment, there are three major modalities of treatment in as far as cancer is concerned. One is the chemotherapy, second is surgery, and third is the radiation. These three modalities have evolved in their own way, and now we are using the recent and sophisticated techniques in the management of cancer patients. Coming to the chemotherapy, now we know what are the best ways to give, what are the best combinations to give, and there is a concept of new adjuvant chemotherapy where we reduce the size of the cancer, where we get valuable information that what is the effect of chemotherapy on the cancer, whether a particular chemotherapy that we are using is working on cancer or not working, and in case we need to do some modification, we are able to do modifications. Then we have some genetic test or some advanced molecular test, which is also called as NGS, next generation sequencing. This help us understand that if a particular type of chemotherapy or a drug is going to help a patient or not. We also decide about certain therapies such as targeted therapy or immunotherapy, and we incorporate them in treatment, because these molecular tests and advanced tests, they help us understand that this particular therapy is going to help this patient. So there is a dictum, one size does not fits everyone. So we call this as personalized therapy. So there can be 10 different people with same cancer, and we can have 10 different therapies for them. Or this has been particularly in the management of lung cancer. We know that there are so many driver mutations that we can target, and almost 50% of lung cancer patients, they do not require chemotherapy because they have some driver mutation or they are eligible for immunotherapy, which is different for chemotherapy. Particularly, I know that people, they are scared of chemotherapy, they are skeptical to take chemotherapy because of its side effects. So we have other options also, and then there are other cancers in which also the role of these newer therapies modalities is coming up. Then coming to surgery, now we are having, previously we used to have extensive surgeries. Now we are having minimal invasive surgery, which is available in our hospital also, and now we are moving towards the robotic era of robotic in the cancer surgery. We have organ preservation approach where we are able to preserve the organ. We are able to take out the cancer. We are able to cure and still able to preserve the organ so that the functional ability is retained. Because, for example, if somebody is having head and neck cancer and we cure it and the person is not able to speak or swallow, it becomes very difficult for the patient. But now, with the newer modalities, we are not only able to cure him but able to spare his speech and swallowing function as well. This gives a lot of confidence to the patient and faith in the treatment also. Now, coming to the radiation, again, we have advanced techniques of the radiation which gives which with which we are able to give radiation with a lot of precision. We are able to target the organ where we want to target the disease, and we are able to spare the surrounding organs of any toxicity. The tolerability of the treatment becomes better with these advanced machines and the way we deliver the radiation therapy. I agree with the dictum that cancer is the emperor of all maladies. But once we come to know about enemy, it should be easy for us to deal with it. We should not smoke in tobacco in any form. We should restrain from alcohol consumption. We should follow a healthy lifestyle. With these things, we'll be able to keep majority of cancers at bay. Even if we get it, if we are aware and we do proper regular screening, we'll be able to pick it up in the early stages where cure rates are higher. So I think we need not to be scared of the cancer, we need to be aware of the cancer. This is my message for a common man.